Why might you get pain under your rib on the right side of your abdomen? So let's think about the organs that we have there. We have the rib cage, we have the liver, the gallbladder, the head of the pancreas, and parts of the bowel. So for something like rib pain, it could be you've had trauma, there could be pain or tenderness when you press on the actual rib cage, the bone or the bits in between the bones, and that can cause a really dull ache, which can be really tender. But if it's worse when you're pressing the rib cage, it might be something called costochondritis, which is literally just an inflammation of the rib and the cartilage. Now, if you've got right upper quadrant pain, then the liver and the gallbladder tend to come hand in hand. The pain could be worse with eating, that you could get a yellowing of your eyes or a yellowing of your skin. There could be an infection, there could be a fever. There's loads of different things that could indicate something going on with the liver or the gallbladder. But one test that we do is something called Murphy's test. So that's where you're lying down flat, we press down on the right upper quadrant, and we get you to take a really nice big deep breath in. And if that makes you catch your breath, that could suggest inflammation of the gallbladder, because as you breathe in, your liver and gallbladder go downwards as your lungs expand, and you essentially are touching the gallbladder with your hand, and that can make you catch your breath. And that would essentially mean that you need to go to hospital and be seen by the surgical. The most common cause of an infection of the gallbladder is caused by gallstones. The head of the pancreas doesn't really cause any kind of pain, but a painless jaundice, so this is where you've got yellowing of the eyes or yellow skin without any pain in your tummy, could signify that there's something like a cancer of the head of the pancreas. And then you've got your bowel. So you could have something like a duodenal ulcer or a peptic ulcer where you'd get pain within a couple of hours of eating, and it would be a really sharp, gripey pain. Now, when it comes to gallbladder pain, gallstone pain, you can get this thing called biliary colic, where it comes in waves, and it's usually related to the food that you're eating or after you've eaten. It's worse with eating fatty foods, and it's more common in people who are female, middle-aged, overweight, and have had lots of children.